Pregnant women behind bars often endure a nightmare of neglect and cruelty that most people can hardly imagine. Rihanna Clariere was only 18 when she went into labor in a cell at HMP Bronzefield. She pressed the emergency call button again and again, begging for help as the contractions sharpened, but no one came. Alone, she delivered her baby girl, Aisha, and had to bite through the umbilical cord herself. When staff finally arrived hours later, the infant was lifeless. Rihanna's story is not an isolated tragedy, but a window into a system that repeatedly fails incarcerated mothers. Pamela Wynn, a former surgical nurse in the United States, learned this in the most painful way. Arrested on a non-violent charge and several weeks pregnant, she was shackled during transport and fell on the way to a prenatal appointment. She began bleeding and pleaded for immediate care, but prison staff delayed treatment for weeks. The pregnancy ended in a miscarriage. Even during that emergency, she remained chained to a stretcher. Years later, Pamela became a national advocate, helping to push through the First Step Act, which bans shackling pregnant women in federal custody. Her activism speaks to how personal suffering can spark broader reform, but the fact that such reform was needed at all shows how routine this abuse is. Other women describe similar experiences. Jessica Umberger was forced into a cesarean section and then separated from her newborn while her own infection went untreated for days. Rebecca Figueroa labored while shackled and watched officers carry her baby away moments after birth. Tracy Edwards was in treatment for opioid dependence when prison staff abruptly cut off her medication, triggering severe withdrawal that endangered both her and her unborn child. In each case, the physical harm was compounded by the trauma of being treated as less than human at a moment when compassionate care is most critical. Some of the stories are almost unbearable. Tiana Leo's cries for help echoed through the jail as she felt her labor begin, but guards dismissed her pleas. She delivered her baby into a cell toilet. Ashley Caswell suffered a placental abruption, a life-threatening condition, and gave birth on the floor of a jail shower. Jenny Jones, a high-risk pregnancy, went into premature labor while officers mocked her distress. Babies born in these conditions often face serious health problems, and some do not survive. The mothers are left with grief, trauma, and the knowledge that the system valued control over life. Cherry Bird's ordeal illustrates the same indifference stretched over days. She went into labor but was left untreated for nearly a week. Shade Swazer delivered a stillborn baby after similar neglect. In these cases, guards and medical staff ignored obvious signs of labor or delayed hospital transfers until it was far too late. Each story underscores a larger pattern. Prisons and jails that treat pregnancy not as a medical condition requiring urgent care, but as an inconvenience to be managed with restraints, suspicion, and delay. These women are not exceptions. They represent a wider crisis. Across the United States and other countries, incarcerated women are far more likely to experience high-risk pregnancies, yet their access to prenatal care is minimal. Private prison contractors often cut costs by limiting medical staff. Guards receive little training in obstetric emergencies and are sometimes openly hostile, seeing pregnant inmates as manipulators rather than patients. Even where laws prohibit shackling or mandate prenatal care, enforcement is spotty and oversight weak. The result is a system where neglect is predictable and preventable deaths continue. What makes these stories even more striking is the resilience of the women who survived. Pamela Wynn turned her loss into a movement, founding Restore Her, to advocate for the rights of incarcerated pregnant women. Jessica Umberger speaks publicly about the trauma of separation from her newborn and the need for accountability. Families of women like Rihanna Clariere and Shade Swazer demand independent investigations and stronger safeguards so that no one else endures the same fate. Their voices push for laws that guarantee prenatal care, ban restraints during labor, and hold prisons accountable when they fail. The collective message is clear. Pregnancy behind bars should never be a death sentence or a gauntlet of humiliation. These women may have been accused or convicted of crimes, but they remain human beings and mothers. Adequate medical attention, dignity during childbirth, and the chance to bond with a newborn are basic rights, not privileges. The repeated tragedies, from a baby born lifeless on a concrete floor to a mother shackled as she miscarried, are not isolated accidents. They are the foreseeable outcome of a punitive system that prioritizes control over compassion. Real reform will require more than isolated lawsuits or piecemeal legislation. It demands independent oversight, proper medical staffing, and a shift in culture that recognizes pregnant prisoners as patients deserving of care. It means funding community-based alternatives to incarceration for pregnant women whenever possible, so that childbirth does not happen in a cell at all. Until these changes occur, the stories of Rihanna, Pamela, Jessica, Rebecca, Tracy, Tiana, Ashley, Jenny, Cherry, and Shade will continue to repeat, reminding the public that justice without humanity is no justice at all. These accounts of suffering are not just personal tragedies. They expose how prisons and jails are structurally ill-equipped and often unwilling to care for pregnant women. Across many facilities, budget cuts and understaffing mean that even basic prenatal checkups are rare. Medical staff may visit once or twice a week, if at all, and emergencies are often handled by guards who have no medical training. Pregnant inmates report that requests for a simple doctor's appointment can take weeks to process, a delay that can turn manageable complications into life-threatening crises. Restraints are another widespread abuse. Even though medical organizations such as the American College of Obstetricians and Gynecologists have declared shackling during labor dangerous and inhumane, many jails continue the practice. Officers argue it is necessary for security, despite the fact that a woman in active labor is extremely unlikely to escape. Restraints not only cause physical pain and restrict movement, making delivery harder, but also increase the risk of falls and interfere with essential medical procedures. In some cases, women remain handcuffed to hospital beds throughout labor and even after giving birth, unable to hold or nurse their newborns. The trauma does not end at delivery. In most prisons, babies are separated from their mothers within hours or even minutes of birth. New mothers often return to their cells still bleeding, without adequate postpartum care, and with little information about their infant's health. The emotional toll is profound. Postpartum depression and anxiety are common even in supportive settings, and incarceration magnifies those risks. Some women never regain custody of their children, leading to lifelong heartbreak and fractured families. Racial and economic disparities deepen the crisis. Black and Indigenous women in the United States are already at higher risk of pregnancy complications and maternal mortality due to systemic racism in healthcare. When these women are incarcerated, those risks multiply. They are more likely to be dismissed as exaggerating pain, more likely to be punished for asking for help, and less likely to receive timely medical attention. Poverty also plays a role. Many incarcerated women were unable to afford consistent prenatal care before their arrest, making ongoing medical support even more critical once they are in custody. Legal battles and advocacy efforts have brought some progress. Lawsuits filed by survivors and their families have resulted in settlements and policy changes in certain states. The First Step Act, at the federal level, bans shackling of pregnant inmates, and a number of states have enacted similar legislation. Yet enforcement remains uneven. Some facilities ignore the rules or exploit loopholes that allow restraints under vague claims of security risk. Oversight agencies are often understaffed and reluctant to penalize violations, leaving women vulnerable despite the appearance of reform. Grassroots organizations are stepping in where the system fails. Groups like Restore Her, Pregnancy Justice, and Motherhood Beyond Bars provide legal support, lobby for stronger laws, and educate the public about the hidden realities of pregnancy in prison. They also advocate for alternatives to incarceration, such as community-based supervision or residential programs where mothers can stay with their infants. These initiatives not only protect maternal and infant health, but also reduce recidivism by maintaining family bonds and offering social services. The stories of women like Rihanna Clarieri and Pamela Wynne highlight a fundamental truth. Punishment does not have to mean cruelty. Societies that claim to value life cannot look away while babies are born on cold cell floors or mothers are forced to give birth in chains. Real accountability would involve independent monitoring of every facility that houses pregnant inmates, mandatory reporting of all pregnancy-related complications, and guaranteed access to comprehensive prenatal and postpartum care. Public awareness is key to change. Many people never consider that women are giving birth behind bars or that infants are dying because guards ignore a call button. Sharing these stories forces the issue into the open and pressures lawmakers to act. Journalists, advocates, and survivors continue to speak out so that what happened to Rihanna, Pamela, Jessica, Rebecca, Tracy, Tiana, Ashley, Jenny, Cherry, and Shade is no longer hidden in silence. Until there is a shift from punishment toward compassion, these tragedies will continue. Pregnant women in custody are not nameless statistics. They are mothers, daughters, and members of our communities. Protecting their health and dignity is not a privilege they must earn, but a human right the state is obligated to uphold. Each time a baby is lost because a guard ignored a plea for help, it is not only a failure of one prison, it is a failure of society as a whole. The deeper one looks into the issue of pregnancy behind bars, the clearer it becomes that the suffering of incarcerated mothers is not the result of isolated mistakes, but of policies and attitudes baked into the correctional system. At the heart of the problem is a culture of control and suspicion. Guards and administrators often treat pregnant inmates as potential manipulators rather than patients, assuming that any complaint of pain or request for care is an exaggeration or a ploy for special treatment. This mindset leads to dangerous delays in medical attention and an environment where the health of both mother and baby is secondary to discipline. Funding priorities reinforce the neglect. Many jails and prisons contract out their medical services to private companies that are paid a flat fee per inmate. The fewer services they provide, the higher their profit margin. Routine prenatal visits, ultrasounds, and emergency transports cost money, so these companies have a financial incentive to limit care. For pregnant women, this means that conditions like preeclampsia, gestational diabetes, or infections may go undiagnosed until they become critical. Staff shortages further compound the danger, especially at night when medical personnel may not be on site at all. In such circumstances, even a diligent guard might be unable to get a nurse or doctor in time. The legal framework meant to protect incarcerated pregnant women is riddled with gaps. The Eighth Amendment to the U.S. Constitution prohibits cruel and unusual punishment, and courts have ruled that deliberate indifference to medical needs can violate that standard. Yet proving deliberate indifference requires evidence of intent or reckless disregard, a high bar that many cases cannot meet. As a result, many women whose rights were clearly violated never see justice. State laws vary widely, and some offer no explicit protection against shackling or denial of care. Where laws do exist, enforcement often relies on the very agencies accused of abuse, creating a cycle of impunity. International human rights standards provide clearer guidance. The United Nations Bangkok Rules call for alternatives to imprisonment for pregnant women and mothers of young children, and explicitly ban restraints during labor and postpartum recovery. Countries such as Canada and several European nations have programs that allow some pregnant offenders to serve their sentences in community-based settings or mother and baby units designed to support early bonding. These models show that humane alternatives are possible, but they require political will and public recognition that punishment need not sever family ties. The mental health impact on mothers who give birth in custody is profound. Postpartum depression affects many women under normal circumstances, but isolation, lack of support, and the immediate separation from a newborn magnify the risk. Women describe feelings of guilt, anger, and deep grief that linger long after release. Some develop post-traumatic stress disorder, haunted by the sounds, smells, and helplessness of their jailhouse labor. Children who survive these births may face their own challenges, from health complications to attachment disorders, especially when bonding in those crucial early days is interrupted. There are, however, signs of progress driven by relentless advocacy. States such as New York, California, and Minnesota have enacted laws banning shackling at all stages of pregnancy and requiring regular prenatal and postpartum care. Some jurisdictions have launched pilot programs where mothers can stay with their infants in supervised residential settings rather than behind bars. Evaluations of these programs show lower recidivism rates and better health outcomes for both mothers and babies. While these reforms are uneven and often underfunded, they demonstrate that alternatives are not only humane, but also cost-effective compared to the expense of emergency medical interventions and lawsuits. Community organizations fill critical gaps. Restore Her, founded by Pamela Wynne, lobbies for legislation and provides education to incarcerated women about their rights. Pregnancy Justice offers legal assistance and works to end the criminalization of pregnancy outcomes, such as miscarriages or substance use disorders. Motherhood Beyond Bars focuses on maintaining connections between incarcerated mothers and their children through visitation and support services. These groups also work to educate the public, sharing stories that humanize the women affected and counter the stigma that often silences them. Public engagement is essential because policymakers respond to pressure. When media outlets publish investigations and survivors testify before legislatures, reforms gain momentum. The emotional resonance of a baby born on a cold cell floor or a mother giving birth in chains can move people across political lines. Faith-based organizations, medical associations, and civil rights groups have all joined the call for humane treatment, creating coalitions that push for systemic change. Yet for every law passed, vigilance remains necessary. Even in states with strong protections, women continue to report being shackled or denied timely medical care. Without independent monitoring and consequences for violations, policies can remain little more than paper promises. Advocates argue for mandatory reporting of all pregnancies in custody, routine inspections by outside agencies, and the creation of rapid response teams to handle obstetric emergencies. Transparency and accountability, they stress, are the only ways to ensure that reforms are not quietly ignored. Ultimately, the stories of Rihanna Clarery, Pamela Wynne, Jessica Umberger, Rebecca Figueroa, Tracy Edwards, Tiana Leo, Ashley Caswell, Jenny Jones, Cherry Bird, and Shade Swazer challenge society to decide what justice truly means. If the goal of incarceration is public safety and rehabilitation, allowing mothers and babies to suffer or die through neglect serves no one. These women may have broken laws, but they remain human beings whose pregnancies deserve the same care and dignity as any other. The question is not whether change is possible, it is whether we are willing to demand it, and to see pregnant prisoners not as outcasts, but as mothers whose lives matter. Ending the cycle of neglect will require a profound shift in how society views both incarceration and motherhood. For decades, criminal justice policy has been driven by punishment and deterrence rather than rehabilitation or public health. Pregnant women often enter the system after struggling with poverty, addiction, or domestic violence, conditions that would be better addressed through social services than imprisonment. Instead, their pregnancies become entangled in a framework designed for control, where every request for help can be treated as a disruption to order. One of the most urgent reforms is to reduce the number of pregnant people who are incarcerated in the first place. Community-based alternatives, such as supervised release, treatment programs, and restorative justice initiatives, offer safer and more cost-effective solutions. Studies consistently show that these options reduce recidivism and provide better health outcomes for both mothers and infants. In states and countries that have invested in such programs, the rate of medical emergencies during pregnancy is dramatically lower, and the long-term social costs are far less than the expense of lawsuits, emergency care, and foster placement. Education and training for correctional officers and medical staff are equally critical. Guards are often the first to witness the signs of labor or complications, yet many receive no formal instruction on prenatal emergencies. Basic training on recognizing labor symptoms, understanding the dangers of delaying care, and responding without bias could save lives. Likewise, medical providers who contract with prisons need clear, enforceable guidelines for prenatal visits, nutrition, and postpartum care, backed by penalties for facilities that fail to comply. Another key reform is the creation of independent oversight mechanisms. Relying on internal prison reviews has repeatedly proven ineffective, as facilities have an inherent conflict of interest when investigating their own misconduct. Independent state or national boards with the authority to conduct unannounced inspections, review medical records, and publicly report findings would add transparency and accountability. Public reporting is powerful. When conditions are exposed, community pressure and media attention can drive political action in ways that private complaints cannot. Broader cultural change is also necessary. The stigma surrounding incarcerated mothers often prevents them from receiving compassion or even basic respect. Public narratives that depict them solely as criminals erase the fact that many were victims of violence or systemic inequities long before they were arrested. Shifting the conversation to recognize their humanity and the innocence of the children affected helps build empathy and momentum for reform. Media coverage that highlights personal stories rather than statistics can play a major role in altering perceptions and sparking public outrage when abuses occur. Former inmates who have endured pregnancy behind bars are some of the most powerful advocates for change. Survivors like Pamela Wynne and Jessica Umberger testify before legislatures, speak at conferences, and mentor other women. Their first-hand accounts cut through political rhetoric and show the real human cost of indifference. By supporting these voices, through funding grassroots organizations, attending public hearings, or simply amplifying their stories, communities can help translate personal pain into systemic change. Ultimately, ensuring the health and dignity of pregnant prisoners is not a matter of charity. It is a matter of basic human rights. International standards, from the United Nations Bangkok Rules to the World Health Organization's guidelines on maternal care, recognize that no person loses the right to safe childbirth because of incarceration. Governments that fail to meet these standards risk not only moral condemnation, but also legal liability for preventable deaths and injuries. The question is whether policymakers and the public will act decisively. Every month that passes without reform means more women entering labor in unsanitary cells, more newborns separated from their mothers, and more families scarred by trauma that could have been prevented. Protecting pregnant prisoners demands urgency, investment, and a collective acknowledgement that justice is measured not by how harshly we punish, but by how faithfully we uphold the dignity of every life, even those behind bars. Transforming this reality begins with recognizing that the incarceration of pregnant women often reflects broader social failures rather than individual moral weakness. Many of the women who end up in jail or prison were already marginalized long before their arrest. Poverty, inadequate health care, domestic abuse, and substance use disorders frequently play a role in both their pregnancies and their criminal charges. Addressing these root causes through accessible health services, affordable housing, and addiction treatment would prevent countless arrests and reduce the number of pregnancies occurring in custody in the first place. Preventive measures outside the justice system can be life-saving. Community clinics that provide prenatal care without judgment, programs that treat addiction as a health issue instead of a crime, and policies that protect survivors of domestic violence all lower the risk that a woman will enter jail while pregnant. When society invests in these supports, it creates pathways that keep mothers and babies out of cells entirely. Public health experts consistently point out that every dollar spent on early intervention saves multiple dollars later in emergency medical costs, child welfare services, and incarceration. For those already in custody, the first step is guaranteed access to comprehensive medical care. This means regular prenatal checkups, proper nutrition, and immediate response to signs of labor or distress. It also means ensuring postpartum care that goes beyond the first few hours after birth. Women recovering from childbirth need follow-up visits to monitor healing, mental health assessments for postpartum depression, and resources to help maintain contact with their infants. Simple improvements, like allowing a trusted support person during labor or providing breast pumps, can have an enormous impact on both mother and child. Nutrition and living conditions deserve special attention. Pregnant inmates often rely on standard prison meals that lack the extra calories, protein, and vitamins required during pregnancy. Advocates recommend specialized meal plans and access to prenatal vitamins as basic rights rather than privileges. Similarly, sleeping arrangements should allow for rest and comfort. Yet many women report being forced to sleep on thin mats or hard bunks even late in pregnancy, increasing the risk of complications. Clean drinking water, regular exercise opportunities, and relief from extreme temperatures are not luxuries. They are essentials for healthy pregnancies. Maintaining the bond between mother and baby is another crucial element of humane care. Some countries and a handful of U.S. states have established prison nursery programs where mothers can live with their infants for the first months of life under supervision. Evidence shows these programs improve child development outcomes and reduce recidivism, as mothers are motivated to stay out of trouble for the sake of their children. Where nursery programs are not feasible, frequent and private visitation rights can help maintain that critical connection. Allowing skin-to-skin contact, breastfeeding, and regular phone or video calls helps both mother and child thrive despite separation. Changing public attitudes is equally important. Too often, society views incarcerated pregnant women through a lens of punishment, believing they have forfeited their right to compassion. Yet every major medical and human rights organization stresses that no one loses the right to safe childbirth. Public education campaigns, documentaries, and first-hand testimony can help shift this perception, reminding people that protecting these mothers protects the next generation as well. When voters and taxpayers understand that neglect leads to higher costs, lawsuits, and preventable deaths, they are more likely to demand legislative action. Political momentum can build when diverse coalitions unite. Medical associations, civil rights groups, faith-based organizations, and fiscal conservatives have all found common ground in opposing the mistreatment of pregnant inmates. Their arguments vary. Some emphasize morality, others cost savings or legal liability, but together they form a powerful force for reform. Successful campaigns in states like Minnesota and New York demonstrate that bipartisan support is possible when the public understands the stakes. Finally, sustained oversight and accountability must ensure that reforms are not hollow promises. Laws banning shackling or requiring prenatal care mean little without independent monitoring and meaningful penalties for violations. Advocates call for transparent data collection. Every pregnancy in custody should be documented, every birth reported, and every complication reviewed by an external body. Public dashboards, regular audits, and whistleblower protections would help ensure that abuses cannot be hidden behind prison walls. The path forward is challenging but clear. By reducing unnecessary incarceration, guaranteeing comprehensive medical care, supporting mother-child bonds, and enforcing accountability, governments can protect the lives of women and their babies. These changes affirm a simple truth. Dignity and safety during pregnancy are fundamental human rights, not privileges that depend on a person's legal status. When society commits to this principle, it not only prevents needless suffering, but also signals a deeper understanding of justice, one that values life and compassion over punishment and neglect.